Dr. Malhotra, we're excited to have you here. The AASM, obviously, I'm sure all of you are familiar with the American Academy of Sleep Medicine. Dr. Malhotra is, I believe you're the incoming president of the AASM for 2000.
Yeah, current president. I took over in June.
Current. All right, okay, all right. So current president, along with being a professor of neurology at Washington University in St. Louis. So really excited to have you share about the AASM's perspective and efforts.
Great, and I'm assuming everyone can see my slides.
They are a little bit, at least on my screen, I'm not seeing your full slide. It's
Let's try it again here.
Kind of, it was like.
Any better now?
Perfect.
Okay, very good. Thank you. Sorry. It looks like I get that Zoom virus too, where sometimes it goes wrong right when I need to share. So thank you, Julie, for the invitation. Thank you, Project Sleep. I've definitely enjoyed being at this dinner party as well, and really, really appreciate the privilege and honor of being invited to share what we're doing from the Academy standpoint. As mentioned, the Academy is over 11,000 individual members and sleep centers, and we not only include physicians, but all members of the sleep team who take care of patients with sleep disorders. Our mission is stated as advancing sleep care and enhancing sleep health to improve lives. And, if we look at it, we're not only talking about within the walls of the clinic or the sleep center. We definitely value promotion of population health and public safety in that mission as well. And so just wanted to briefly, in the very short minutes, kind of go over what we are looking at our priorities and what we've been doing over the last year as well. Clearly, we're very excited with the Sleep Health Caucus, and definitely appreciate the two representatives. Starting that, we did have our first briefing, which the topic of sleep health in the pandemic, but clearly we want to continue to grow this caucus for all of us so we can use that to accomplish our goals. And then again, we also internally from the Academy standpoint, continue to want to bring the patient voice to everything that we do, whether it is advocacy, education, guideline development. I think the representative from the CDC mentioned that we were fortunate to get that CDC grant to help with public awareness of obstructive sleep apnea, but we are working on putting a lot of effort on public awareness of all sleep disorders, whether it's idiopathic hypersomnia, like our person has, to narcolepsy, to circadian rhythm disorders, insomnia, so forth. And as Gary mentioned with telemedicine, and I agree 100% with what he said, so I'm not gonna, he said it much better than I definitely could have. But CMS did expand coverage of COVID-19. Clearly, this has been a huge help for our patients, as already mentioned, and we feel strongly that that needs to be permanent, and not only for the what's been mentioned as far as convenience goes, but if you really look at our sleep patient population specifically, we don't want our patients who are feeling sleepy. Maybe it's unsafe for them to drive if they're not doing well with their current regimen, driving sometimes hours to see one of our sleep providers in clinic. It's absolutely vital that they have that option of doing a telemedicine visit, and we don't, as a public safety issue, they should not be on the roads if they're having problems. And we feel like besides the convenience and access, and of course during this pandemic, the minimized risk to the virus, we actually feel that there's a safety for our patients and for others on the road, that they shouldn't have to be forced to drive hours to come see us if they have narcolepsy or sleep apnea and are struggling with their treatment. And we should try to provide very good care via telemedicine. And part of that will be HIPAA flexibility, and that's something that has been given to us during this pandemic. But what that means is that we shouldn't have to buy, for example, one program to do telemedicine. Our patients need to be familiar with the programs that we're using, like Zoom, like FaceTime. We want those to have some flexibility, because the more complicated we have that for the patient, the more difficult it becomes. We talked about, of course, coverage. This is not going to happen unless it's covered, and that's why it never did happen until now. But then again, the other challenge that we've had as providers is telehealth services across state lines. I live in St. Louis. I'm about maybe 15 minutes from Illinois, and what I quickly realized is that these patients that were driving 15 minutes to see me, if they happened to live in Illinois, I suddenly couldn't see them via telemedicine, which was not fair. And unfortunately, a lot of those patients were underserved patients. So it seemed unfair that they would have to drive in and take a risk with the virus, whereas my patients out in the suburbs that were happened to be in Missouri, I could see them, even though it seemed like we were providing the same type of care. There have been waivers been put in place, but we think that really showed that that kind of artificial barrier of a state in a city like St. Louis, for example, can really harm patient care. Fortunately, there is two different bills looking at telehealth, the Telehealth Modernization Act. It is a bipartisan bill, which is very unusual this time and age. So that makes us even more confident that maybe we can get some movement. And you can see that both of these have some support behind them, but we need to continue to get support to get this through to the finish line. Another thing that hasn't been brought up yet, but I believe there's a speaker after me that's going to be talking about prior authorization. And we definitely see this as a major stumbling block for a lot of our patients, whether it's narcolepsy patients, other hypersomnia patients, or insomnia patients that are been given medications. We typically have to go through multiple steps to get a medicine that we know is going to be best for our patients, and sometimes have to even try medicines that we feel may be even dangerous for the patient just to get that coverage of that medicine that we think is safe. And it almost seems like both the patients and us are jumping hurdles to get them a care when I think we all agree how frustrating it can be as a patient navigating the healthcare system already. We think that working on this front, and there is an effort supporting prior authorization reform on seniors that is in Congress, and we're going to hopefully at least start there, but hopefully reaching the rest of our population as well. And then lastly, the last thing I wanted to cover was our Philips Respironics recall of PAP devices. This is definitely something that we've been working on, not just on our own, but with other societies like ATS and other medical professional societies and patient advocacy groups. For those of you not aware of the recall, it was in the summer. Interestingly enough, 2 days after I took over as president, where they had a massive recall of Philips Respironics machines. And the challenge of that is obviously that's no one's necessarily fault that happened. The challenge was it was such a large scale of machines, talking about millions of machines being recalled all at once, that the notice was really given out through the news media because that's where our patients were hearing about it. So the messaging of what to do and how to call really wasn't sent probably in a controlled manner. And that led to some chaos for our providers and patients. And then really not even knowing as much about how long is it going to take to get a machine that can be fixed. What are the risks? There was a concern about a risk of cancer, which types of cancer, what is that? And then just to make things a little bit more challenging, there are obviously supply chain challenges occurring now on many items, including CPAP machines. And so we're getting concerned about having a shortage of machines to replace these millions of machines that have to be recalled. And then, of course, added to that is the risk of we have children on CPAP, and what does this recall mean to children? We can only assume that there's probably more of a risk. And so this is something that we're engaged with the FDA right now, trying to help navigate this for our patients. And then as Gary mentioned again, we do think that the CPAP adherence rules were concerning to start with, but especially during this pandemic where access can be a problem, and definitely during the Philips recall. What if you decide to stop your machine because you're worried about a recall? Are they going to suddenly take away coverage of your machine now because you decided not to take that risk? And so we need those rules to be relaxed in these kind of unusual times. And then lastly, kind of on a long-term scale, we continue to feel that the coverage requirements, as mentioned in the previous presenter, Gary, on our patients who use CPAP is unfair to certain races, ages, and underrepresented minorities. We also feel that actually the strict requirement for diagnosis of sleep apnea can also be specific to certain populations. And so we continue to advocate on behalf of those patients that we think actually will benefit from CPAP. And so we're continuing to engage with policymakers in regards to that as well. And so again, I did want to thank Project Sleep, and it's really refreshing to see all the wonderful people on today's Zoom call. And we can really only, these are huge challenges for the sleep field as we saw today. So I think we really need to work together to hopefully get to our goals. So with that, I'll go ahead and stop sharing my screen, and thank you for the time.